Good evening, everyone. I'd like to call to order the Community Mental Health Full Board Meeting. And I'm going to begin with reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Motion to adopt the agenda is in order.
I would so move.
Motion by Birdie, support by Brown. Flynn, sorry. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. The agenda is adopted. Next is hearing of the public. Is there anyone from the public that would like to address this board? You have 5 minutes. You can stand up at the lectern. Anyone? Seeing no one, we'll move on to approval of the minutes of the regular meeting of the board that was held on February 28 of 2018.
Move to approve.
Support.
Motion and support. All in favor signify by saying aye. Yes, sir.
I lost track of that. What item are you on, please?
Item number 4. We're approving the minutes.
Thank you.
All in favor of approving the minutes from February 28?
Aye.
Aye.
Opposed? Motion carries. Next is approval of the standing committee meeting minutes from Program and Budget Committee that was held 2 weeks ago on March 14 of 2018.
I move.
Motion by Flynn, support by Kraft. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is request to approve item number 6. Approvals of items 6 and 7 are items that we've discussed at Program and Budget.
Move to approve. I move that we approve A, B, and C.
6A, B, and C?
Madam Chairperson,
Yes.
I'd request that
6C
6C be separated.
be separated, okay, we'll do that. So we'll take a vote on item 6A and 6B. Schmidt, seconded. A is to request an extension of the current specialty services contract for 12 months and approve the appointment of Laura Cutting to the Citizens Advisory Council. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item 6C, a request to approve the commercial lease amendment at the UBHC. Lou, did you want to address that?
I won't make any comments. I just want to vote no. I made comments at Program and Budget.
Okay, you just want your,
Happy to discuss it if you want me to.
you just wanted your no vote carried forward?
Well, in particular, but maybe I should make a comment or two for John. One of the reasons I'm voting no on this, John, is when you first proposed the UBHC budget on the record, I made a comment that I didn't think the budget was sufficient. And you have increased the budget 2 or 3 times since then. We're at about $250,000 to $300,000 on the budget for UBHC off the top of my head. And what concerned me was when the factor became evident that the building was not 25,000 square feet, it was actually 6,000 some odd square feet less, there was a credit of about $150,000. What I don't understand is why we didn't take the credit against the $300,000 that we have in the budget situation since initiation, especially in view of all the cuts that we had been making. Secondly, I was concerned why we didn't enter into negotiations under the condition that since the lease originally was presented at 25,000 square feet, why we did not move to vacate the lease on the basis that it would give us an opportunity to move the UBHC into a region that had more Medicaid-rich consumers. instead of staying in a situation that we're technically bleeding to death. TJ mentioned that we had shifted 130 personnel to the building, and that if we didn't have the building, we'd have no place to put 130 personnel. That struck me as a little peculiar because we haven't hired anybody in 2 years. So the 130 people that we have there are original 130 personnel, so we could always send them back from where they came from, that we didn't need the building to support 130 people that supposedly are new people, because they're not. We haven't hired anybody in 2 years. Last but not least, this is going to continue to be negative. The point is, we agreed to move the $150,000 to a new owner going forward, and that new owner agreed to assume the liability of the previous owner, and the only reason a new owner would do that is because they could negotiate the purchase of the building at less money. And I'm wondering why we're participating in a situation like that when the UBHC situation on Garfield is killing us.
Okay,
And so I'm going to vote no, because I think this continues a very negative situation, John, and I don't quite understand it, nor do I understand the rationale that was put forward for this board to support it. So frankly, I just think in good conscience, I need to vote no, because I think it's a mistake, and we missed an opportunity to do something about it.
do you want to address that or not?
So, thank you for the
If
opportunity,
you want
Madam
to,
Chairperson.
Yes.
You raise good points. I think the most pertinent point I think you raise is, the relocation of the UBHC. Should we have it down around 9 or 10 mile road, someplace where there's a larger Medicaid population? Perhaps. And, there's still opportunity to do that. There's still opportunity to, get out of the lease that we're currently in, or to strategize on, relocating the UBHC. So let me make that point. I think that's a good point that you made. The second issue or point that you made is there's cost neutrality here. The new lease that we revised leased, regardless if it's the current landlord who owns it or the new landlord who owns it, we're going to recoup our overpay amount, and so it's going to be cost neutral. We didn't get a $160,000 check in our pocket, if that's what you're suggesting. We just agreed to accept reduced payments over the next 3 years. So in end, the lease is going to be cost neutral. And then the other thing I have to say too is I still have a conviction, and I think the administrative staff have a conviction in the UBHC to grow roots and to be able to be of service and benefit to the community. It's a painstakingly difficult challenge. I think we still need to continue to network and to be able to have it be the program that we wanted it to be, kind of like climbing a sandhill, going up a couple steps and back one. Through Jim's efforts, Jim Losey and some of the administrative staff, they also have been able to reduce our cost related to our operations, not only the lease, but the number of staff that are in there. They continually redesign the program. It's still open as a UBHC, limited hours, and they're also providing other opportunities for discharge from hospital services for an immediate intake and those types of continuity of care issues that are occurring. So is the UBHC open 24/7, 365 in the ideal? No. Is there still opportunity to get there? Perhaps. And so we're going to continue to work on it.
Thank you, Jen. Seeing no other speakers, all in favor signify by saying aye.
I just turned my light on.
Okay.
I have to agree that it's located in the wrong place. It shouldn't be way out here at 19 miles.
Thank you. Oh, we need a motion and support.
Go with the
Motion by Flynn,
Support.
support by Brown. Thank you. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is motion to receive and file. Receive and file the non-liability of CMHSP and PIHP risk and the executive brief from February 28th. Those were discussed at our last meeting. Do you want to, all right, we need a motion for that? These were all, we discussed all these at program and budget. Motion by Doherty, support by Schmidt. Any questions or comments? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item number 8, resolution for employment retirement by Karen West, and that document should be in front of you on the desk.
I move that Karen West be recognized and retired. And this is an excellent proposal, application. Good job.
Support.
Motion by Joan, support by Linda. Any other comments or discussion? All in favor signify by saying aye.
Aye.
Any opposed? Motion carries. Next is item number 9. Approval request that the Macomb County Board of Commissioners, a motion for us to request that the Macomb County Board of Commissioners remove from consideration the resolution that was approved by the Macomb County Community Mental Health Board's Program and Budget Committee on March 14, 2008. That was the meeting from 2 weeks ago. Motion by Birdie,
Support.
support by Nagovan. Any comments? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item number 10, voucher listings. Motion by Birdie to pay the bills,
Support.
support by O'Connell. Any comments or questions about the list of bills? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. And next is item number 11, the management report.
Good evening. Nice to see everybody. For our calendar, our first meeting coming up is April 5th, which is a Thursday morning at 7:30 is a Recipient Rights Advisory Committee meeting. Moving to our Program and Budget Committee meeting April 11th at 6 o'clock here. Full board meeting is April 26th at 6 o'clock in this room. And it's my understanding we need a recipient rights appeal hearing meeting on April 19th or 20th. I'll turn that back to Joan.
Thank you. When is our full board? It's been moved to Thursday.
26th. The full board meeting is April 26th. It was moved. It was originally on the 25th, and this meeting, this room is a conflict for us, so we have to move it. And we agreed last week, I believe 2 weeks ago, to move it to 26th.
So we have a recipient rights April 5th. And when does the next one have to be? Before when?
My notes here indicate April 19th or 20th.
How about the 18th?
No, on the 19th, Joan, it's the member services meeting in Langston.
Oh. The 18th is fine. What about the 18th, I said?
The 18th is fine, as far as I'm concerned. I don't know if they have
Wednesday, the 18th.
The request for the 19th and the 20th was by the complainant.
Is the 18th okay?
The request, Joan, the
Okay, the 20th,
Friday, the 20th?
yes.
Thank you. The spring conference is at the Diamond Center at Suburban Collection Showplace in Novi. April 30th is the pre-conference. May 1 and May 2 is the full conference. And I'll turn that back to the chair. Motion for board and administrative staff attendance.
I'll move.
Motion by Flynn. Support by Doherty? Was that, or Schmidt? All right. To approve staff and board members to attend. The conference.
in Novi.
Any discussion? All in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you. And the Michigan Association, the Community Mental Health Boards, or CMHA, sorry, is still interested in our participation in PAC. And so your opportunity is still to represent Macomb County in your contribution of $35 or more to the PAC campaign.
I think everybody has contributed but me. Has everybody? I don't know. Barbara? Four haven't. Gee. Well, I'll have to apply pressure. Okay, thank you.
Remember, the Tigers game is online, so let's not forget that. As you approved the last time we met, I believe that there was a opportunity to do community outreach and the mental health minute. So maybe you've heard it or not. It's been on the radio for the last week and a half, and it's got another few more days before it wraps up for our first mental health minute, and that was around depression. And then soon enough, we'll go back to the studio and do another 2 segments of mental health minutes and have somebody that will actually do those, send those messages. And then also over the last week, there was an opportunity to interview with Elisa Z, and she does a forum every Sunday morning from 6 to 7 o'clock in the morning about issues that are affecting or addressing our community. And so a couple of us went down and interviewed with Elisa. So there's a 15-minute segment that show up on Easter morning at 6. So set your clock for 6 o'clock in the morning before you. 104.3. It's going to be on 5 different stations, but 104.3 is one off the top of my head. I believe it will show up Easter Sunday. It didn't show last Sunday. I suspect it will be.
Through the chair. John, did you get a message from TV Warren?
I did. And I passed that on to the media specialist, and so we're going to wrap back around and do that public outreach through Warren. We appreciate that, too.
Okay, thank you.
Thank you. Pleased to inform you today, right before coming here, that we received notice of certification for 3 years for our Children's Crisis Stabilization program in Macomb County Community Mental Health. It was an opportunity and pretty much a requirement, I believe, of the PIHPs or the CMHSPs to establish a intensive children's crisis stabilization program. So you have to go through a Medicaid certification to actually do that and be able to deliver that service and bill against it. So we received our notice today that we're good for through March of 2021.
Very good.
Thought the board would like to know that. Also, for the board's awareness, we have had for years and years and years a Survivors of Suicide Fund, and that fund has grown to about $15,000. And back when we had a Survivors of Suicide group and affiliated through our crisis center, people who were survivors of suicide would actually make personal donations to that account, and in remembrance of a lost loved one or whatever it may be, and in support of the cause to work towards suicide prevention. And so that $15,000 has actually sat on the books for a couple years, and my finance folks tell me that that's really not permissible for those dollars just to sit there. You really need to expend them. So over the course of the last probably greater 6 months, we've looked at a number of different proposals, and I had a great proposal that come from one of the staff. And so the total amount in the proposal was $14,800 in that fund. In an effort to expend it, we are going to support $1,200, and it's an administrative prerogative that I have. I'm just informing the board of what's occurring. $1,200 that would actually go to an agency, No Resolve. And if you recall, when we had Survivors of Suicide, No Resolve picked up the Survivors of Suicide initiative. So on April 21st, there's a meeting that's going, not a conference that's going to occur. Spring Healing Conference, Good Morning, M-O-U-R-I-N-G, Good Morning. There's a keynote speaker. We're paying $500 for that. Circle Healing Drummers, $350, and a light lunch of $350. So we're going to help support that Survivors of Suicide Conference in the tune of $1,200 out of that suicide money. There was also, I'll just throw this in the sequence of where it appeared. There was also a request for mental health first aid, for expansion of mental health first aid to support survivors of suicide. That was for $6,900, and I denied that. Not that I'm denying mental health first aid. I don't believe the mental health first aid should be funded out of the Survivors of Suicide program. I don't think there's enough, in my opinion, direct correlation between mental health first aid and suicide. We are going to continue to expand mental health first aid, and there's monies that can be had to support mental health first aid, just not going to support it through Survivors of Suicide. So that piece was denied. But we will expand our mental health first aid. With our police departments, we already have an initiative doing that. One of the other items was through prevention, Macomb County's Suicide Prevention Coalition, to train people in question, persuade, and refer. That's kind of an initiative they have to question people, persuade them, and refer them for services. So $400 that will go to the Macomb County Suicide Prevention Coalition. At least 150 people will benefit from it in 2018, including 150 booklets. And so that's a $400 amount that was approved. And then this other one's pretty cool. Kindness Rocks. There's actually kindness rock gardens that have been put up. There's an awful lot of healing that goes to, and I'm the best to speak to it, but people who are going through survivors of suicide or have been in those support groups really understand the value of being able to do some of these projects and crafts, and crafts is an understatement, that allows them to help and heal in their grief. And so this Kindness Rocks initiative, where they're going to actually put gardens, I think there's a garden out there now, they're going to put some other gardens in the community for $1,048. That was approved as well. And then the last item under this proposal, for your awareness, was the Yellow Ribbon Campaign. And the Yellow Ribbon Campaign was a very active initiative through the Macomb County Crisis Center over the years. I don't think it's as active as it has been, and we want to provide a resurgence there. So people, all of the people, the students in the county will eventually end up with a card, a yellow ribbon card. It's like a business card, and they carry it with them in their wallet, their purse, or wherever. And then and then there's posters and brochures and education that goes along with it. And if you're a troubled child or adolescent or young adult in school, and you're feeling that suicidal ideation, not certain, or grief, whatever it may be, you take your card out and you hand it to somebody. And you don't have to say nothing different. And that is the notice to cry for help. And then everybody in the school knows that someone has taken their yellow ribbon out, their yellow ribbon card out. So it's really cool. It's an ask for help card, and we're going to support that in the tune of $5,725. So the total ask is just short of $8,000, and so that leaves us still with about $7,000 in the fund. And I'm going to kick it back to the administrative staff to come up with more proposals so we can liquidate those dollars as we should. that are directly related to survivors of suicide and suicide prevention. So I wanted the board to be aware of that. And then the last item I have, and I sent it to you, I don't know if I end up on a good note or a bad note here, but I sent to you the change in allocation for general fund for the community mental health services programs over the next 5 years. Not to pay attention to the fact that we received about $728,000 reduction in general funds this year from last year. And the CFO, Cindy Mack, presented that last week or 2 weeks ago at the Program and Budget Committee. So we actually received $728,000 less general fund in 18 than we did in 2017. In the piece of paper that I passed out and for the audience, there's a copy there as well too. This is the 5-year plan that the Department of Health and Human Services has for general fund reductions in redistribution. And so, you know, we're old hat at when it comes to redistribution. We all know what that's about because we went through the Medicaid redistribution. Macomb County is going to receive 11% reduction in general fund dollars, which is $888,000 over the course of 5 years if this sticks. It probably won't get better. It could get worse. I think Oakland County was at about $19,000, and I'm sorry, 19% to the tune of $2.3 million, if I recall correctly. And then Wayne County, they are taking a hit of 57%, or $22.5 million. Half of their GF is going to go away. So again, pardon me? 57%. So they're going to go from a base of 39.4 to 16.9 in 5 years. So Willie Brooks, the new CEO there, is not real happy. The metro region is getting hit again disparagingly hard. Genesee County had a reduction, but Region 10 overall was fine. There was a small reduction in Bay Aranac County, and then in I'm trying to think in the very southern part of the state, Summit Point, I think it's called Summit Point. That PIHP was hit a sizable amount of Medicaid dollars too, or general fund dollars too. The other 40 CMHSPs are all receiving additional dollars, up to as much as 301% increase. So that is the graph. That's the realization that we have. And so, you know, for your awareness, and I want to reemphasize too, so from your awareness, you know, we've seen this coming, and so we put out an executive directive. You know, my staff and I put out an executive directive back in early January saying that we can no longer afford people's spend downs. So if you don't meet your spend down, your general fund requirement, you know, we don't have the money to pay for that. And so there's not a pocket or a fund to get that from. So we're no longer able to purchase spend downs for folks, and that's unsettled a lot of folks. It's left people without supports and services. In some cases where they're not monitored at night, you know, those are the things that worries all of us. It worries the board. It worries the administration that some of our consumers are not receiving the services that they may need. But I don't have a good answer for that, because you and I and we don't have the general fund dollars to be able to support their services where they need to be monitored all the time. And the way it operates in Macomb County, as I've indicated before, is no different than any other county in the country. Once you meet your spend down, you get Medicaid. And until you meet your spend down, and some counties, some states don't have a spend down methodology. They have a deductible, or there's just a minimum amount that consumers themselves have to pay before they're Medicaid eligible. You don't have a Medicaid benefit, even though you're Medicaid enrolled. You don't have a Medicaid benefit until you meet your spend down. And so I don't have a better place to get those monies other than to, you know, be particularly critical in that this board, administration, the public, the providers, everybody understands that we're going to provide services, and I'll continue to say it because I think it's home row where we need to be. Nothing more than medical necessity, nothing less than medical necessity, and only based on one's benefit plan. So if you're Medicaid, you get nothing more or less than medical necessity, and if you're general fund, you don't get Medicaid services. You get general fund services, nothing more or less. And so that's the challenge that we have here. I don't know how we make up $888,000 other than, you know, ongoing due diligence to control our acute inpatient costs, to, you know, to work on our UBHC costs, and they're coming back in line. My largest concern is the impact on consumers. We just don't have the general funds. So here we are. If you have any ideas on what we should do, that's really the public safety net that we have going on. If you have any ideas what we should do, you know, certainly let me know, and let's, you know, discuss those, how we can better improve our system of care. But, you know, not long ago we had $26 million in general funds, and now we're going to have we're about $7.5 million. So we don't have the same dollars we had before. But I'd be more than willing to hear ideas that people have. And that concludes my report, unless anybody has any questions.
Linda?
Just reading this letter, it's just, I hope everybody reads this letter, this cover letter. There's a sentence in the middle of the first paragraph that says that they're being adjusted to more equitably distribute the resources based on the needs of the population. They're taking what is already too small of a pot, that being the state general fund, that, you know, when they cut it a couple of years ago, when they said the ACA Healthy Michigan would fill in for our general fund population. And then they're cutting us 19%, so the formula may be working for other people who are getting the increase. The formula is not working for us. It's just really disappointing to read this letter.
Do you have a question?
And it says that the association was on the committee and agreed to it. I would think the regional dinner would be a hot seat for Mr. Sheehan. When's our next regional dinner?
June is the next dinner.
I think Brian had a question.
Did you hit Brian?
Yeah. Two questions. Was it for the radio station? Is that AM or FM?
FM.
FM, okay. Thank you. And then I heard 2 weeks on the radio from one of the news stations that the manufacturer of Narcan is going to supply every high school and college in the United States free Narcan. Have you heard anything about that, or is there anything trickled down to the schools that are in Macomb County, or?
I will defer to Randy O'Brien.
I haven't heard that. I've heard in the past they had talked about providing that, but I haven't heard that recently. It's never happened to my knowledge. So.
Yeah, it was on one of the radio stations. I was surprised they said they were going to supply everybody. The manufacturer was going to do that. So I wish I could remember the station, but I can't. Thank you.
Susan?
Thank you, Madam Chair. So, John, with regard to this redistribution, it indicates here that the work group was created with a representation of the Michigan Department of Health and Human Services and various CMHSPs and CMHAM to develop the new methodology. Do we know who that work group was? Specifically, like names and
The Michigan Department of Health and Human Services General Fund Work Group, or thereabouts. Yeah.
So who's the CMHSPs, right? I mean, those
We
are
all have an opportunity, whether it's CMHSP or PHP, even a Medicaid work group. You know, we sit in on. You'd be surprised how many work groups we sit in on as a PIHP, and how many times we're in Lansing. I'll bet you we're on 20 or 25 different work groups. You know, our staff. So we're attending to what we're doing here locally, and also we're attending to our interests as a CMHSP and a PIHP. You know, the irony with some of those work groups is you can participate, but they're going to drag you along with, you know.
So looking at these numbers and seeing the disproportionate hit that Southeast Michigan is taking. I mean, somebody correct me if I'm wrong, but doesn't Southeast Michigan have like 2/3 of the population of the state?
64 to 67%.
Thank you. So why are we not banding our legislators together? This is what I want to, why are we not lockstep and saying, you know what, this is ridiculous?
Well, it's got today's, or the date on it of the 26th, so it's 2 days old. So
Okay.
there's great opportunity now in, through the metro region and our lobbyist efforts to, call this to question.
So, I mean, this kind of stuff is just setting me on fire because, I mean, as it is, I'm sure a lot of the board and the staff, but, I mean, I know that we've been talking to the legislators, and I know that we've been talking to them a lot about our own issues with the, the rebasing and stuff, but, I mean, this has got to be, we've got to do an absolute takeover. I mean, we've got to band together and do an absolute takeover of this thing and shut this down. I mean, this is the kind of stuff that should bring anarchy. I mean, I can't believe it. I mean, and how do we set that fire?
Well, collectively, through the metro region, we have the majority of the legislature.
That's what I'm saying.
You
I
know.
mean, we should be able to lock this down and say, you know what, anything you want, it's frozen until this happens.
I believe I think the legislature, from my vantage point, could put pressure on the administration to rethink their methodology. But, the same as the Medicaid appropriations, once the legislature passes and the state passes those Medicaid dollars on to the department, it's up to the department to decide how those are distributed. And that's where they bring in the Milliman actuary and they get the certification through CMS and the rates are established. And so this is out of the legislature's hand at this point in time unless we reenact the legislature to scream foul in some way.
So I understand that these department heads are appointed positions by the governor, right? And so they don't have a direct correlation and responsibility to the legislature, right? But the legislature does have the ability to budget into these departments, right? And they can red circle things, right?
I would imagine with enough political pressure, they can do a lot of things. But at this point in time, I believe the actions here by administration are well within their authority to proceed as they have so far until there's enough rebuttal and public outcry.
Well, certainly they're free to do whatever they want to until they have to answer to somebody, right? I just want to be clear. So, okay.
I would see that, I wonder, is that one of the unintended consequences of term limits, that they don't have the legislators not having the institutional knowledge
I don't
of how some of that works?
I don't disagree, but even a term-limited legislator, I would hope they still have a conscience. I
Oh,
mean,
absolutely, but they, if they're not aware of how what just came down, which they will now become aware of, then they can't do anything if they're not aware that's going on. So.
Right. I just think these kinds of draconian cuts and this rebasing and, I mean, it's just, I don't know.
Speechless.
I'm speechless. Thank you.
I have Joan, or I'm sorry, Linda and then Joan.
John, I'd be interested in an email this week on what Mr. Sheehan, what his justification he gives for supporting this kind of cut to the metro region. Like if you call him and ask him, do you know the background? I know the letter just came out the 26th, so you know maybe don't even didn't even know this was happening. So, but I would like to hear his rationale for supporting that, for the association supporting such a cut to the metro region.
He's in a funny spot.
Oh, sure, but make
'Cause
him tell
40
you
of them,
at
40
least.
of them are kind of giggling right now,
The what?
40 of the CMHSPs are
Right.
kind of giggling right now, you know what I'm saying? So he's in a tough spot. So I don't know if he'd give you an answer that would, I don't know how to answer. I don't know if he's in a bad spot, if he says too much about the reductions to the metro region and at the same point in time that, the work group felt that their formula for reallocation was fair, that it supported the other 46 CMH or 40 CMHSPs, that he's probably hearing support and appreciation from those CMHSPs, that they actually got their increase that they probably felt they were long overdue.
And they maybe did need an increase, but that doesn't mean we can afford to cut. One of the problems is a small general fund pot that they think we can fight over.
Is that all, Linda? Yeah, I guess. Okay, Joan?
Why don't we move our dinner up? Not have it in June, have it sooner so we can talk about this with our regional. Why don't we do something like that? If you want to get people together, you've got to get them together. Ours is in June. I'm talking region. I'm not talking legislators again. If
Right.
they want to come, fine. But we're not getting together with Detroit, Wayne, and Oakland till June, did you say, John?
I think they,
Yeah, but who shows up there? Not as many that show up at the,
perhaps our opportunity is to, at the on May 1st and 2nd, which is, there's still 30 days out, but we're going to be together as a board for breakfast at those who are going to be attending.
yeah, but how many show up there, John? A lot of people, not as many that comes to our dinner. I don't know, it's food for thought.
Well, thank you. I think that's an idea to consider. As you said, it's just the timing. It's kind of hard to pull those meetings together, so we might need all that time before the next scheduled one anyway to come up with a good set of facts and information.
Okay, thank you.
But we'll have John look into it, see if there's something else that could be done in the meantime. Is there anyone else that wanted to address that?
One thing.
Yep.
And, before I give up on my director's report, I think I already did, but before I do actually give up, I want to extend my thoughts of sincere appreciation to Marilyn on behalf of the administrative staff, of your support of us as an administration, and your serving on the board for as many years as you have. We really appreciate you, and we'll miss you as well, too.
Thank you very much. I've enjoyed it. Thank you.
And then in that second breath, Marilyn, I talked to her and, gave her my personal, appreciation for what she did. And she says, only a good agency works if there's change, right, Marilyn? Which you told me earlier, and there's new people, and there's change, and otherwise agencies won't live well, or something along that. Very good words. You're going to get your chance to get the mic before we get out of here tonight. But that being said, I also would like the board and the administration to welcome Lori Phillips. And Lori's in the back row there. Lori, you want to stand up? So Lori was appointed by the board. So I hope I'm not stealing anybody's cause, but I wanted to make sure everybody recognizes Lori. We look forward to working with you and helping us out with our challenges that we have every day. So, all right.
Are you done? For sure? Okay. The next item on our agenda, thank you for that report, by the way, and is other agenda items. And I would like to start that out by also, on behalf of the board, thanking Marilyn Brown for her many years of service. I know she served for a long period of time, took a year or two off, and then picked right back up again. We so appreciate, I appreciate all your knowledge based on, your personal experience with your family. It's just, invaluable, and it's been very, very wonderful working with you. Getting to just hear another side of things that, decisions that are made, how they impact people, and I so much appreciate that. And we have a card here for you that I'll bring over to you, but would you like to say anything? Because we love hearing from you.
I have enjoyed serving, and as I told John, in my life, as I've observed organizations, there's always got to be change, and you do need to have new people come in to an organization to keep it growing and alive. And I was concerned about whether or not I was going to be reappointed, but I decided that whatever was meant to be will be, and it will be for the best, and that's how I feel about it. So, and I think the lady Lori is taking over. She seems to be a very good candidate, and I'm sure she'll enjoy serving.
Very
Thank
good.
you.
Thank you again, Marilyn, for all your service. We so much appreciate it. Is there anyone else wanted to say anything?
Yeah, well,
Joan.
I have something to, well, I appreciate Marilyn. We were there sweating it out. I'm lucky I got back on the board. So, anyway, what I wanted to say, not about Marilyn, but Sacred Heart has called us. You know, where Sacred Heart is in Memphis. I think it's in Memphis. And I'm going to take a tour. And I wondered if any of the commissioners wanted to go. Maybe we could get a van and take the tour. But if you're not interested, I'm going. I think Linda's going.
Do you have a date and time, Joan?
No, because I just got this confirmation that she said we could take the tour. You know, they built a new facility next door. I have toured the old place, but now, and they were building when I was out there 2 years ago. And I think it would be a credit for people to go out and see, if you haven't been out there. And would there be a van? Do you have something that we could take, John?
No, Jim's got a big car.
Oh,
I don't think we have a van.
you don't have a van?
Do we have a van at ACT? Is it a nice van? Good van?
Well,
Do you have a van? And maybe some of the staff wants to go out. Anyway, I'll,
It's not that far.
yeah. How many would be interested? Yeah. What about you, Lord? Phil? Yeah. Well, go in your truck. Oh, yeah.
all right. So if people who are interested, get the information to Joan, and
Yeah,
and she'll come up with some potential dates and times
Sure.
that would work out.
Sure.
Okay. Thank you.
And I'm pretty sure that Crossroads got their accreditation too, didn't they? You didn't mention that.
They did. I think they had their accreditation, and then I think they had a few, 3 or 4 items they needed to correct on their, or to improve on their accreditation, but they did receive a certification of full accreditation, if I'm not mistaken.
Well, they're going to be recognized. I don't know if it's at this conference or the conference in October, but they're going to be recognized, right? Our leaders up there, we've been working on that. Okay. And I'm sorry to see my partner go next to me. And Mr. Brown. That's all.
Thank you, Joan.
And please give your $35 in.
All right. Thank you, Joan. I have Lou and then Linda.
For your information, at the March Member Services Committee meeting, Crossroads was approved for the award, which will receive a formal announcement pretty soon. So that'll happen, I'm guessing, at maybe the fall conference. I'm not exactly sure when that will happen because there's a series of them. The other thing is, my memory may be failing me, but somehow I don't recall a motion made for the spring conference. I may need a little correction here, but if anybody's going,
did.
you better go with a motion.
We did.
We did it? Okay.
It was when John reported it out, then we took a motion.
Okay, it's my gray hair, so.
Did you want to tell them about the accommodations, Lou? Well, not everybody can stay.
Well, no, that's a good point, Linda, thank you. The hotel that's adjacent to the conference center only has, I think, 180 rooms that's available. So each unit will receive notice from Chris for 2 rooms at the hotel, and the rest will have to stay at the spin-off hotel down the road, which is about 5 miles away. So that's going to happen. They're going to set up a bus situation back and forth, but that'll probably be in the morning and at the end of the day is my guesstimate of how that's going to work. So you may have to be doing some commuting. There's just no way around that. The problem is that we can't find a hotel in Michigan that has breakout rooms, conference space for the size of our meetings, and has sufficient hotel rooms. That's becoming an almost impossible challenge. So that's the adjustment. We made a 1-year contract with this hotel for the spring conference to make an evaluation of how this works. But we had to give up the Dearborn facility because that had deteriorated so badly that everyone was making so many complaints about the hotel room and the accommodations and so forth. So we canceled that contract, and this was the only other available substitute. So when we get the notice, we'll have to decide based on attendance for the rooms, because the hotel is adjacent to the conference space. It's a 2-minute distance. It's really attached in the hallway, and that's where the executive board and those meetings will occur. So that's going to be the key for that part of it. Thanks for the reminder, Linda.
Linda, did you have something else you wanted to bring up?
Well, I just wanted to say that I'm going to miss Marilyn. I met her in the 90s when she was on the Citizens Advisory Council, and I think all of us have learned to read contracts better because of Marilyn. So that's your legacy, at least.
Thank you. Anyone else? Seeing none, we will move on to item number 13, the hearing of the public. Is there anyone from the public that would like to address this board? Anyone from the public?
Yes, I would.
So if you'd come up to the lectern and give us your name and address, and you have 5 minutes.
Thank you. My name is Sam Woodard. I live on 22405 Glenwood Street, Clinton Township, Michigan. Mr. John is familiar with me. I've hounded his office for quite a while. Through the blessing of Macomb County Community Mental Health, my son, Joel Seth Woodard, was moved to the Oconomowoc Prater Willie homes in Oconomowoc, Wisconsin in November the 27th. And he had a terrible time of it. He was 26 years old, never been away from home before, and suddenly he had responsibilities. And it was a very difficult time for him for the first 2.5 months. We've been visiting him all through that, and 2 weekends ago we went up, and he was a different man. He'd lost 33 pounds, and he was actually picking pieces of paper up off the floor rather than putting them on the floor. Just a totally different attitude. So we are very excited about what is happening. But I would like to remind Mr. Kinch, who reminded me, that you were looking to build a facility for Prater Willie individuals here. You're spending approximately $110,000 for five individuals now in Wisconsin, when you could be actually housing them here in a facility and saving. I don't know, I don't have a head to know how much you would be saving, but a significant amount. So I encourage you. I'm sure there are some who are actually looking for a facility for that purpose, but I would encourage you to do that, because I think, first of all, we wouldn't have to travel quite so far to get to Oconomowoc, Wisconsin, but more than that, I think it would save our county a lot of money. So anyway, I appreciate all that's been done, and I'll be coming back again to give you more reports, but I appreciate the input and what it's done for my son. Thank you so much.
Thank you very much for sharing that with us. Is there anyone else from the public? Anyone else? Seeing none, we'll move on to item number 14, which is adjournment. Motion to adjourn is in order. Motion by Doherty, supported by Schmidt. All in favor?
Aye.
This meeting is adjourned. Thank you, everyone.